Thank you for inviting a contingency of Lancashire people onto your stage today. It's great to be here at the AWS Summit. My name's Amanda. I'm a clinician, I'm a psychologist, and I'm now the Digital Health Clinical Lead for Lancashire and South Cumbria. And this is my colleague Andrew Thompson, our Operational Lead, and he'll close the show. So we've been on a development journey with our public, our digital leaders, our boards and our chief execs, our frontline clinicians across more than 2 years now, and we just want to share some of our experiences with you. The above graphic depicts our offer to the public and to the system of Lancashire and South Cumbria. And we have purposefully and specifically put empowering the person at the heart of our offer. This graphic, this strategy and this approach has been co-designed with the public, with digital leaders and with our system, and has been through every board to get buy-in and a recognition as to why the person needs to be at the heart of our offer, designing things around a person to really help health and care manage the flow and the capacity and the demand and to offer the best of services. So I'm only going to present 2 slides, and I'm going to just try and explain to you the reasons why we need all this clever stuff to help the health and care system. And I'm probably the least technically minded person in this audience. I'll leave that to Andrew in a moment. But do take down our details, because we are going to be very concise. And I would just love to change my whole talk and talk about the workforce and digital competence and confidence in our workforce from board to ward. But I'll stick to the script and I'll go back to thinking about how we're empowering the person. But of course, to do that, there's a lot of work we need to do with the front line. We have to manage our systems more efficiently and effectively, and we've always got to have our eye on the future, that exponential change. So 2 slides from me. And I'm doing the flip sides of a coin. Let's think about empowering the person, creating those digital citizens. We know 86% of homes have internet access, 82% of us go online every day, and 72% of us have smartphones. It really, really is time for us to think about how we utilise technology and digital solutions for health and care, and to make it as easy to manage your health and well-being online as it is to book a holiday, as to shop, and to track your parcels. And I've got one arriving just about now at home, and I hope my husband's back from his interview to pick it up. We know that business and industry and partners like AWS take real close attention to having their customer and their consumer and understanding the customer and the consumer. And I don't think we're as good as that in health and care. We've got much to learn from you. But over the last 9 months, 100,000 more people across Lancashire and South Cumbria have started using an app that allows them to book GP appointments online, look what's coming up, change their appointments, order the medicines with very little help or kind of marketing around this. People are starting to realise that this is an opportunity. Having open access to your healthcare record is now a part of the GP contract, and people ought to be able to access their health and care records without having to ask for it in the very near future. And it's brilliant that there's a government push now and a recognition that you and I, the public and the patients, are the best people to be responsible for our health and care records. So being able to access it is critically important. And our front door and our systems need to help people do. Look on there, they're all doing words purposefully to do things. This is not about the public and patients being passive recipients of care. This is about how we activate people to be able to manage their own health and well-being. And if you're well informed and you know where to look and what to read, the decisions you make and your ability to keep yourself well for longer improves exponentially. Wearables, self-monitoring, quickly becoming the norm. They need to be able to go straight into a care record so everybody can look at how many steps I've done today, and I've done more than usual getting around London. And did I really drink that much over the bank holiday weekend? My insulin levels are low, or even my stress levels. We can even monitor the galvanic skin responses and know whether we're anxious or not. And I am a little bit anxious up here today. But then I can take action. If I know what's happening to me and my body, I can respond. I can do something earlier. Get up, Amanda, do a bit of exercise. Don't drink till the next weekend, Amanda, and I haven't so far. Inject insulin. Well, that's just an example. I'm not actually a diabetic, but calm down. Yes, I really do need to calm down right now and just land what I'm trying to land for you. So it's our responsibility in health and care, whether we're clinicians, informatics staff, leaders, execs, whatever it is, to make sure the resources are available to help us book, change, check. Because you can talk to your consultant from your own home. One less outpatient appointment, one less trip to a hospital car park. This is available to us now. We have to enable it. And it's important, we've talked about equality and diversity, it's important to note that not everybody is in a position to access technology, afford it, or feel confident about using it. And where that's the case, we're not going to give up on people. We are going to try and furnish them with some of those solutions. We're going to try and support people to go online and to manage their health digitally. And we'll always offer alternatives if that is still not possible. So, that's our citizens. What about our front line? How do we support and create a digital workforce? Well, we know we need to. If you saw the press this morning, 30 to 40% of GPs are going to retire in the next 5 years. 1 in 11 nursing posts are vacant. 1 in 10 radiology posts are vacant. We will always look for the talent and we will always look to fill those posts, but digital can absolutely help us fill those gaps. And a speech and language therapist who's trying to help someone with swallowing problems, she can see 5 people in a day if she online consults into care homes rather than attempting to save 1 life. Or a consultant psychologist, me, I can offer therapy to a group of people across Lancashire and South Cumbria from their own homes with specialist services for people, and things like people like young onset dementia, where it doesn't feel right to bring them into a community of older people when they're only 54. Or an MDT can take place virtually so that your mum gets the best of care and all that expertise from wherever it is in the world. And when you are trying to offer direct care, there in the moment, saving lives. Again, there's a list of doing words up there. We on the front line can do things differently if we're digitally enabled. An A&E consultant has somebody there that's semi-conscious. Have they got a raging infection? Are they under the influence? Have they got any psychological needs? You need to be able to see the whole of that healthcare records to help save people's life. If you fractured your leg rambling in Barrow in the Lake District and you actually live in Burnley, the Burnley radiologist, the Burnley team, the Burnley Fracture Clinic need to be able to see your images. Or an ambulance crew or the police who are responding to a person who stood the wrong side of that bridge. What is their crisis care plan? Who do you ring at those moments? How do they manage to keep themselves well? What is their opportunities? And it's not just the benefit for safety and quality. Just one of our acute hospitals in 2017 started sending all of their outpatients and discharge letters back to their GP electronically, and they saved £62,000 in second-class stamps. So there are efficiencies that we need to sweat as well as the quality. And then just imagine a time when we are using data differently that's readily available across health and care, and we're pulling it down and we're using it consistently and then using that to predict and prevent disease. And Andrew will talk to you a little bit about that. And there's all sorts of clever AWS services that we're exploring, like recognition. Why don't I work with older people, people with dementia? Let's have a picture on their EMIS GP record, and if they do end up, unfortunately, disorientated in the back of an ambulance, we can pull down that image and make sure people are reunited with their families. The opportunities, the needs are just endless. Let's capitalise on the digital offers around us.
So I wanted to give Amanda enough time to talk that through, because that's actually what this is all about for us. Empowering the person has been a journey for us. Started, now we're going to get into tech. We started on a patient record exchange service, which we called Lancashire Patient or Local Patient Record Exchange Service. It's a standards-based approach, very unstructured in the first phase of this, very PDF-based with a bit of metadata sat around this sort of approach. 3.5 years ago, we've gone through a journey to adopt cloud-native services. As I'm sure there's quite a lot of people around the audience who are going through that journey now. From a governance perspective, We were hosted in local IT data centres by local trusts. And the reason I say that's from a governance perspective is because when we started this journey, cloud was still a vision. Risk around hosting data, risk around ownership. Things have changed. Things have changed in regards to the work that NHS in England and Digital have done on cloud-first strategies, and adopting cloud as a strategy has enabled us to start thinking of future-proofing our approach as a regional ICS. We then moved, after about 18 months of a record-sharing initiative, into a hosted data centre, and that was so that we could start thinking about scale, agile, elastic-type approaches, without being locked into traditional approaches to buying IT services. Like it says on the slide, we've got 5 main providers of services. We've got 4 acutes, one traditional mental health organisation, but provides community services. We've linked in our local authorities, our regional councils and local authorities. So where are we now? We are going through a process of migrating to AWS. We are moving with a support partner, ANS in Manchester, with a cloud-native support partner to a fully managed, in essence, master patient index approach to managing a shared care record. Building on that, we've been recognised as a local health and care record exemplar region. What that means for anybody who doesn't understand in the audience is there are 8 regions that have been chosen, 5 initial, we're a fast follower for that, and that region is Lancashire and South Cumbria, Cheshire and Mersey. So we're now looking at scale for being able to do standards-based longitudinal record and sharing of records. Share to Care is our brand for our local health and care record exemplar. And like I said, that's Lancashire and South Cumbria, Cheshire and Mersey, and we're getting into that next level approach. So why I'm stood here today, so we're talking about empowering the person. WellPres is our hot off the press, let's say, and we're going to be doing some presentations on this year. WellPres is our PHR approach for accessing the shared care record across Lancashire and South Cumbria. It's been, again, built in cloud native. It's, we're building it on the back of the fact that we will have our master patient index and our shared care record built within Amazon Web Services, and we're building our WellPres approach off the back of it. A whole system approach, like Amanda said, and putting the citizen at the heart of their care. So if we can provide them with all the information and wrap their clinicians around them, what can we do in a different way than we've done historically? This is built on 3 cancer pathways for post-operative treatment. Initially breast cancer, colorectal and then prostate. What we're doing is supporting cohorts of patients for 5 years following surgery with a full citizen-led approach for accessing their shared care record, but also building their pathway of care around them. I'm just conscious of time as well, so we're just from an Amazon Web Services perspective and the functionality we've used EC2, RDS and containers. Amanda had talked about we're testing comprehend around unstructured data and clinical video consultations are sort of built into the programme. Next steps, plans for the future. Further testing on recognition, as Amanda said, significant acceleration on sharing care records, putting the information in front of citizens and clinicians, realising new models of care, so building all the use cases behind this approach and then standardising that as a citizen approach across our ICS. And then the future then we've got work with clinical pathways such as diabetes and then improving quality of experience at life, end of life, so palliative care type approaches. And I think that's pretty much it from me. We've got our details on there as well because I'm conscious we've flown through quite a lot today. So, do you want to add anything else? Okay.